It's all about Mother Nature. We're there to help Mother Nature create a beautiful, healthy baby. There's some wisdom within the body that if the body decides it's time to go into labor after 34 weeks, we should listen to it. And if the body hasn't decided to go into labor, then maybe there's a good reason why not. And if you're going to think that you know more than Mother Nature, you better have some really good medical reasons. Because if Mother Nature hasn't decided it's time for that child to be born, you could be putting that child at risk.
I'm often involved in giving opinion about whether a delivery should take place early based on relative risk to the baby versus relative risk to the mother, balancing risks and benefits to mom and baby together. Most of the time, nature gets it right, and I think it's hazardous if we try to figure out how to do a better job than nature. One shouldn't fool with Mother Nature. There are reasons for pregnancy being between 37 and 42 weeks. Late preterm babies most often are going to be fine, but it's incredibly tragic when a baby who is otherwise totally normal suffers because of being born early when it was not necessary.
I think the safest time of a baby's life is when they're in your belly. When I found out I was pregnant, you do all the things that you think are important to keep it safe, and you don't paint your nails and you don't get your hair colored. And so my pregnancy proceeded normally.
My third pregnancy wasn't any different than the other two pregnancies. It was all very normal. There was no complications. And you get to that part where you're just very uncomfortable in the ending and you just want it to be over. I'm ready to have my own life back again. I'm tired of having uncomfortable sleeping conditions. I'm tired of the maternity weight gain.
Some women just fly through it. They feel totally comfortable. But most women, the end of pregnancy is really uncomfortable. They've gained 30, 40 pounds. You get horrible heartburn. They're not sleeping at night. Their back hurts. They can't really move. Swollen feet, hemorrhoids. It's really unpleasant, and they want it to end. And that's a very reasonable expectation. I also think we're designed that way. If the end of pregnancy were not intensely uncomfortable, nobody would be happy about going into labor. Most women are thrilled when labor starts, even though it's painful, because it means that the pregnancy is going to end. And they get to see their baby, which is fun.
I have wished an early labor on all three children. The first child came at 37 weeks and 1 day. That's how my body works. And when it was 37 weeks and 1 day with this third baby, I had gone to the doctor and I said, "Where am I at?" And she said, "Go home, you're fine." There were no signs that anything was going to happen. Take it easy, but continue on with your normal life. I said, this baby's coming out. I'm done.
Sometimes you'll see a woman who had a baby at 36 weeks that did great, and they want to have their next baby at 36 weeks. Each human being is their own individual, and they have their own genetics and their own development. It's hard for people to understand what may be okay for one person is not okay for another person. I have seen deliveries happen prior to 39 weeks where there have been really bad outcomes.
Lucy's birth, she was born at 36 weeks. Pretty easy, simple birth. Once she got there, they had told me ahead of time that there are some complications with birth of a 36-weeker, that it could be anywhere from sugar to having jaundice and maybe a prolonged stay. She ended up staying in the hospital for 10 days.
Say hi. Hi, Pumpkin Pie. Say hi, everybody. Yeah.
When I found out I was pregnant for the second time, I was very anxious. You know, I was on the edge. But everything was as expected, and the doctors told me I was going to deliver at, full term and I should be fine. And 36 weeks, my water broke.
As a wives' tale, they say vacuuming or climbing stairs or running can make things happen. So I thought, I'll vacuum. And I vacuumed every corner of that house. And by 11 o'clock that night, my water broke.
It's very difficult for us to sort out what really was the reason for preterm birth. Was that really the cause of something the mother did? Or was that just serendipity and not really related at all?
You're living in that moment of questioning yourself. What did I do wrong? And I'm sure there was something that I could have done different. And I had no idea what was going to happen. Having had a baby already that was early and had to stay in the hospital for 10 days. And now I have another baby who's too early.
It's 12:10 on Friday, March 23rd, and I'm going to for C-section. Hopefully have this baby who's going to be fine and strong and healthy. So, that's all I have to say about that.
Premature babies, in comparison to a full-term baby, even the late preterm babies are much more likely to have problems.
The baby came at 2 in the morning. The labor and the birthing all went fine, and the monitors all read fine, and there was no reason to even think that there was a problem with the baby. And that's when it all kind of went downhill. When he was delivered, he was kind of making these squeaky, squealy noises. And then they started saying, let's just put him underneath this little tent and we'll give him some oxygen and then he'll be fine in the morning. That was the last time I held my baby, until probably 3 or 4 days.
So the next morning, the surgeon took him out by a C-section. They take him out and rush him into the other room. And not being able to have that moment of my son up close to me was I can't really find the words for that.
There's an important piece in terms of transition from being a fetus to a newborn that was designed to be present. As soon as the baby delivers, they are put in contact with the mom, skin to skin. Then the baby will begin in the course of the first hour of life to make very purposeful movements towards finding the breast. And if removed from the mom, these babies don't do as well with establishing breastfeeding. And of course, breastfeeding is one of the best things that we can do to ensure the ongoing health of children.
He wasn't getting better. And it just continued and continued to get worse and worse. And you just knew something was wrong. And so 12 hours after birth, he wasn't able to breathe on his own and was quickly intubated.
When I finally got to see him for the first time, he was all hooked up. He actually had to be intubated, where they stick a tube into his lungs and give him air. That's probably the scariest time.
Most often their problems go from being inside the uterus where your lungs are filled with fluid, and then all of a sudden, in seconds, you go from that to where you have to use your lungs. The changes are dramatic and they happen so smoothly. But what I deal with is when that transition doesn't take place the way it's supposed to.
That first night, it was really rough because you're all alone and it's dark and you can hear the monitors going off and you're looking at your baby just all taped up and covered up and taped down, and it wasn't what what I was expecting to see. Nobody should have to come into the world like that.
You couldn't even touch him. I remember trying to hold his hand, and the nurse said, "Please don't touch the baby, that's overwhelming to him." And that's when I started realizing that I wasn't in control of this situation. It's a miserable feeling to look at that little tiny baby in this little tiny warmer with all of these tubes and making this little noise. It's just silent tears roll down your cheeks.
His sugar levels were poor. He had an IV, and he had to be under warming lights. And then he had jaundice.
They have problems maintaining their temperature. They have problems feeding. They can have problems maintaining a heart rate and a respiratory drive. Those are the big issues that are going to hit them immediately. They can also have problems maintaining their blood sugar, and if their blood sugar drops low, they can have seizures. We are not designed to have children until 40 weeks gestation. And so while most women will think back on those last 5 weeks as being an unpleasant period of time, I've never seen anybody traumatized by that period of time. However, I have seen women traumatized by having their child in the NICU. I have seen women traumatized by the interventions that had to be performed.
Is everybody comfortable in my house? Is my house clean? Who's going to do my laundry? And how am I going to care for Lucy, my 2-year-old? Who's going to take care of my husband, who still has to go to work? And I also had this little tiny baby at the hospital who needed me 24/7. It was a nightmare.
It was very stressful to be separated from your spouse. He's my rock. He's the one that's going to hold me through it, and I'm the one that's going to hold him through it.
I think for a mother, a long stay has to be horrible. And you spend your days next to the bassinet of your child in a big room with lots of other babies. You participate in the care of your child, but your child's not at home with you, and you're not at home.
This was a major toll on my family. So we have the stress of the expense. We have the stress of these little kids who are wondering, where's mom? I am postpartum. I was depressed. It made me angry that this was happening. It was supposed to be so wonderful and blissful and idyllic, and it was everything but.
For parents who have ended up with a preterm birth that had problems, a very common thing is for the mother to feel guilt. And often there's no reason for them to feel guilt but they feel guilt anyway.
What did I do wrong, and how did he get here? I'm sure it was that fight I had with my husband. I felt like there was something that I could have done different.
And because I made that decision to vacuum, I caused this labor to happen. And I was already making decisions that were about me instead of making decisions about that child. Because I made those decisions, here he is struggling, and I created this mess.
There's lots of reasons to deliver early. If you think the baby's at high risk in utero, with no fluid around a baby, or a placenta that isn't functioning well, or if a woman has a disease that threatens her life. Preeclampsia is a common reason to induce a woman early. But we need to be really sure that we have a good reason to put that woman into labor. The premature baby is much more likely to suffer a permanent illness. They could end up with higher rates of asthma. Learning disabilities are really big. Higher rates of attention deficit disorder and hyperactivity disorder. Gastrointestinal problems, eye issues, some hearing problems. Maybe not things that you see immediately, but things that can happen to that child later in life. I think we all want perfect children, or children that have the best start to life as possible. Our goal is to deliver the healthiest possible baby to the healthiest possible mom, and to weigh the health of the baby and the health of the mom together to make sure that they're both maximized.
The last time I held my baby was 4 days. I cried when I held Tommy. The tears went down my cheeks, and I remember thinking, now it's right. Now this is working out. This is what's supposed to happen. Tommy was in the neonatal unit for 8 days total. He is a happy baby. He's a big chunk, 22 pounds, and he's healthy. He's well adjusted and doesn't even seem like anything is wrong.
Although being healthy and came home from the hospital healthy, he wasn't sitting up till he was like 9 months old. Some low muscle tone, things like that due to his prematurity. But he's overcome his developmental delays due to being premature.
Late preterm babies most often are going to be fine, totally normal. But the appreciation that late preterm is a problem, thankfully, has become much more on the radar screen. Become more of a rallying cry that we need to do something about it.
The rates of preterm birth have clearly increased, and the biggest increases are in the late preterm birth, between 34 and 37 weeks. It's a big concern in the United States. I think that society is putting increasing amounts of pressure on our pregnant moms. It might have something to do with the stress that women in our society are under, trying to balance work and home life. Some women have a lot of anxiety about, is their baby going to be okay? Maybe they've had some bad birth experiences before.
But I don't think that you know for 100% for sure what that baby's life is going to be like once they come out. And in an instant make a decision that can change your life and their lives forever. Our bodies are made to keep a baby for 40 weeks, and that's what's really important. So always be sure that you can make those choices and give that baby the best that you could.
So we'll see one woman say, well, 1 in 1,000, I'm a lucky person, that never happens to me, so I'm not going to worry about it. But I would say that it's unacceptable to have any risk for these little people just because it's more convenient to deliver early. So if you can find a way to focus on the goal at the end, that's what you really need to do.
If everything is fine, just hang on. I know it's uncomfortable to sleep. You're sick and tired of being overweight, but that baby's not ready to come out yet. And why would you risk infections or risk problems or risk the expense? Why would you risk your baby? What if your baby has something wrong with it for the rest of its life because you wanted it to come at 37 weeks or you wanted to be back in your genes? 3 weeks in baby terms is a long time. If you can keep that child in you longer, they nurse better, they will sleep better, and they are happier. And after having this experience, the stress of all of it, just sit down, relax, and just wait.